This episode is brought to you by Shopify. Do you have a point of sale system you can trust, or is it a real POS? You need Shopify for retail. From accepting payments to managing inventory, Shopify POS has everything you need to sell in person. Go to shopify.com/system, all lowercase, to take your retail business to the next level today. That's shopify.com/system.
If you're following our coverage of the Las Vegas mayoral race, you might already know it's a crowded field. Out of 14 candidates, 9 got back to us to schedule interviews. So today on CityCast Las Vegas, we're talking to the final candidate in our series, Donna Miller. Donna is a longtime nurse who also served as the regional director for the AMR Medic West ambulance companies and founded her own emergency med-evac company that retrofits airplanes. She's running on a platform of affordable housing, public safety, and the untapped economic potential of the medical district. It's Sunday, May 19th. I'm Sarah Lohman, and here's what Las Vegas is talking about. Donna, tell us who you are and why you're running for mayor.
Well, thank you for the question, and thank you for the inclusion on this podcast.
Thanks for coming on.
I feel very privileged and honored to speak with you regarding my new journey of running for the mayor. I am not a career politician. I am a nurse that has been in this community for more than 25 years and served in different roles, as you mentioned, as a nurse and first responder for about 20 years, as a business owner for about 25 years, successful business owner that started a business from scratch and grow it into a multi-million-dollar entity and service to our community. And as a community leader who's been involved with the government at the local level, at the state level, and at the national, federal level. I feel like every experience that I had has prepared me for this very journey, as I believe that it's time for our community to be led by a person who can put our community first. And as a nurse for 28 years, putting others first is second nature to me. I also believe that it is time for our city to be run by a business person who understands the value of the dollar and the challenges of small and large businesses and the values of those two working together.
What brought you out to Vegas?
So I am a first-generation immigrant, I like to say, but my daughter likes to correct me, and she's very right. She says, you're a first-generation American. So,
That's
so
nice.
I am originally from Romania. I was 21 years old when I came to the United States. I didn't speak any English. As a matter of fact, I learned to speak English while watching Mr. Rogers' Neighborhood with my daughter. My entire life, I came across people, my entire adult life here in the United States, I came across people that believed in my story, and gave me a hand to assist me in making my dream reality. So when I went to nursing school, I didn't speak English, so I had the nursing book on one hand and the dictionary in the other. I became a flight nurse in 2002, and before I knew it, I decided that I can build an air ambulance that could service this community better than the options we had at the time, which were not local options. So that's how Lifeguard Flying ICU got birth in 2002.
Let's talk a little bit more about some of your work. Tell us about one accomplishment in particular that you're proud of.
So as an air ambulance nurse and operator, I learned a lot about the challenges that we've had. One of the accomplishments that I'm very proud of is changing a legislation that has to do with EMS access with access to healthcare. When I learn about that challenge. It had to do with a patient that had an outcome that was undesirable, and I was trying to figure out why, and learned that there was a loop in the in our law that allowed for companies from out of state that did not have legislation at their home base in their hometown, and they were exempt from ours. So in 2013, actually, I pursued that legislative change, and the law passed unanimously. Then in 2013, we went back. In 2015, we went back and built up on that legislation, and for the second time, our BDR turned into law, passed unanimously and turned into law. So that would be one of my the things that I'm very proud of. It took an entire community to make that happen, right? It's not me, Donna Miller, making it happen. It was me not giving up until I found a solution, and it was working with other air ambulance providers statewide, and with the local health district and the state health district in order to, and of course the legislators, in order to make that come true.
So, what do you think should be the top priority for a new mayor, whether that is you or someone else?
So I think mindset would be one of my top priorities. I'm saying that because I believe that we live in very volatile and disruptive times, and things that were working for us in the past, solutions that were working for us in the past, are no longer working today. So we need to stop for a second and reassess what are the challenges that we are encountering today, look at the solutions that we've applied so far, keep the ones that are still working, and give ourselves permission to let go of the solutions that are not working anymore. Part of that is working with each other, collaboration, whether it is internal within the city of Las Vegas or with other jurisdictions, or between government and private entities. Those collaborations are very important. Co-creating solutions, win-win solutions, that is, meaning that if we work together on finding out the right solutions that would be sustainable, and solutions that actually would be not only to resolve today at the expense of tomorrow, but would be resolving today and building tomorrow.
You said we're living in a very volatile and destructive time. What does that mean to you?
So disruptive things are.
Disruptive, excuse me.
Yeah. So it's volatile. Things are changing very fast. So let's take EMS, right? EMS is in crisis. It's a system that is broken. And it's broken nationwide, right? It's not just broken in the city of Las Vegas. It's broken nationwide. Most people, for example, don't know that EMS is only reimbursed when they transport patients. So the EMS, that is the emergency medical services, in other words, the ambulances, ground ambulances, for example. So a ground ambulance does not get to be reimbursed or paid unless they transport a patient. There is no reimbursement for readiness, for example. So what that translates into is the fact that the reimbursement model is irrelevant for today's reality. The funding is unpredictable. The funding is inadequate. What that's causing is low pay for the workforce, creating a critical workforce shortage. I'm sure we've all heard the challenges that we have with the healthcare workforce, and that includes the EMTs. All of that translates into longer responses for our medical emergencies, so it directly affects our population. So what worked, that system may have worked in the past. Obviously, it had for so many years, but is it working today? Is that I believe that reinventing our EMS system has to be a high priority, and we have to do that before too late. And by too late, I'm saying, and I don't want to scare anybody, but we don't want to wait for us to call 911 and to have no one responding to our emergencies immediately. So Education is a big part of my campaign. So, because of what I just told you about EMS being in crisis, I actually am doing an event during the EMS week, which is next week. That is an awareness event, and it's an invitation to key community leaders to participate in a conversation and hopefully start a further dialogue and brainstorming regarding EMS.
So, as a medical professional, you've called Las Vegas's medical district a gold mine. What did you mean by that, and what are your plans for this area?
So the medical district is a great opportunity to explore in order to improve the access to care that we need for the our community. So being in an air ambulance industry, I know firsthand the type of patients that we need to transport because we don't have access to those services here. For example, transplants. Every single person that needs a heart transplant, a liver transplant, basically anything outside of the kidney transplant has to be transported somewhere else. Having a transplant service here locally is very important. And the medical district is a perfect venue to make that happen and be creative about how we make that happen. When you're saying that a patient is going for a transplant somewhere else, it's not as simple as this patient is just going to go and have surgery there. It has a lot of planning. It implies a lot of planning before the transplant and after the transplant. Those patients actually have to move, some of them have to move to the transplanting facility because once their organ becomes available, they have 3 hours, let's say, depending on the organ, it could be 3 to 5 hours to from the moment they identify that the organ is compatible and it's available to them until the moment they have to be on a OR table. So because that's almost impossible from here, let's say even if your transplanting facility it's in Southern Nevada, it's in Southern California, people that are high up on the transplant list, they actually move to California or closer to the transplanting facility in order to be ready and be in a position to timely arrive to the OR. That causes disruption to the patient, to the family member, because you have to have your caregiver in order to start the surgery. It causes financial disruptions. And this is just prior. After, they have to do follow-up care for every single one of those. They actually have to go back to that facility in California. So see how just one item would make such a huge impact on our community if we were to develop that capability here in our medical district.
This episode is brought to you by Shopify. Do you have a point of sale system you can trust, or is it a real POS? You need Shopify for retail. From accepting payments to managing inventory, Shopify POS has everything you need to sell in person. Go to shopify.com/system, all lowercase, to take your retail business to the next level today. That's shopify.com/system.
At Evernorth Health Services, we believe costs shouldn't get in the way of life-changing care, and we're doing everything in our power to make it possible. Behavioral health solutions that also keep your projections at their best? It's possible. Pharmacy benefits that benefit your bottom line? It's possible. Complex specialty care that cares about your ROI? It's possible. Because we're already doing it. All while saving businesses billions. That's Wonder made possible. Learn more at evernorth.com/wonder.
So let's move away from medical for a bit. I know that's where a lot of your background is, so I want to hear about some of your other ideas for the city. You're also running on a platform of increased public safety. What would that entail?
So the EMS is part of the public safety. So that is definitely a part of looking into the solutions on how to resolve the EMS. But public safety is a pressing challenge nationwide, and particularly in our valley, because I believe our public safety framework is no longer adequately serving our needs. So to me, it's very important to redefine what public safety means for our community today. And I believe that it needs to encompass a broader, more holistic approach and perspective that includes consideration for public health and overall well being. So, for example, today we rely heavily on the law enforcement alone to provide public safety, when in reality, I believe that community engagement would be very important, and not only in the prevention, but also in the addressing certain issues. So that shared responsibility, it's very important to me in order to increase the safety for our entire valley.
What do you
Um,
mean by community engagement? What would that look like?
so engaging our citizens in meaningful dialogue to identify what our issues are, what are our priorities, reimagining our public safety together. Once again, I believe in co-creation, and I think that when we do that, we take ownership rather than just following somebody else's direction. Then cultivating that trust and transparency that we lack today. We talk about defunding the police. I don't believe in that. I think that we need to really look at the issues and look at the pros and cons, figure out once again what works, keep that, and develop new strategies in order to increase that safety. And that includes more than just the law enforcement. It includes all of our community.
Can you give us some examples of concrete public safety policies you'd push for as mayor?
So I would probably like to see the um, integration of technology in the public safety. I know that we have CES here in town every year, and I walk away from CES very excited about a lot of the technologies that are being presented. But I can't tell you really, and I may be wrong, but I can't tell you really what do we walk away. Do we take one item away from the CES to implement in our community? The utilization of drones, for example, would be something that I would be very interested in. Nothing is perfect, right? So we would have to look once again at the pros and cons and balance out the benefits of the community and create regulations that are not infringing, for example, on the privacy of our citizens. Also, I've seen this past CES, I've seen RoboCops, where I think that there's something to be said about that. I know that those are implemented in different communities outside of our city of Las Vegas, and I'm not sure about the United States, but I know they're being implemented somewhere else. So definitely, technology would be have a high priority. And I know we are going to say with what funds, right? Because all of that costs money. The I think that the drone application it can be pretty wide, and it doesn't have to be that expensive. The RoboCop might be a different story. I do believe that looking at a budget and the programs that we currently have and making determinations of whether certain product programs are doing what they intended to do, and if they are, perhaps continue or improve on it. But if they're not, perhaps we need to put a stop and reallocate those funds to programs that would better benefit the community.
So let me ask, since you did mention there is a cost to this, a recent FBI report on crime stats in 2023 shows that murder, violent crime, and property crime are all down, both across the country and in the Las Vegas Valley. So why is public safety such a high priority for you if crime is down?
So I think that technology also has contributed to the crime. I know one of my neighbors recently said that there was a certain activity in the community that she lived in, and she said that there's a lot of neighbors that actually have video cameras, and they have this activity on video camera. So I was able to reach out to our police department, and they immediately sent an officer to look at the cameras. And it's my understanding that the issue has been addressed. So I think that if crime is going down, which honestly, it doesn't feel that way when you hear about some of the crimes, like having people robbing Apple stores in midday in Summerlin. It just feels like people have the courage that wasn't there before. So if there is something that we could do utilizing technology to prevent that, that's very important.
So homelessness is up across southern Nevada. It's up 16% between 2022 and 2023 alone. What would your approach be as mayor of Las Vegas to solve this problem of homelessness?
Well, I'm glad you asked. Thank you very much. Homelessness is a challenge to not to us nationwide, right? But I think that we are very unique in many ways. There's a few things that I would do. First of all, we have resources that are not easily accessible. So one thing that I would do immediately, it's creating an Expedia type of services where someone can go and say, this is my issue. I need assistance with housing. And then that would simply and directly and easily direct them to the available resources. It may be housing, it may be health related, such as mental health. It could be.
Can you clarify, like Expedia, you mean they could go on an app and say, here's what I'm looking for, so like the travel booking website?
Yes, so I'm thinking of Expedia as a very efficient way to list the resources that we have. So yes, that's what I meant. It's almost like a virtual assistant, if you wish, or we're a platform that would put together all the resources that we have today. And while having those resources sign up for that particular website, I would take that opportunity to also assess the quality of those services and see what can I do to enhance their abilities and improve that. So basically, my first step would be to make the best of what we have and build on top of that. The other thing the other priority that I would have when it comes to homelessness is change of the mindset. We quite often think of homelessness as hopeless. So homeless, it shouldn't equal hopeless. The reason I think that's important is because when somebody feels hopeless, they're not going to make any efforts to get out of the situation that they are in. So if we re-empower the people that are in that bad chapter of their life, I think that it would give them the opportunity to reach out and once again go to a place where they can easily access the resources and take advantage of those resources.
What's your stance on the camping ban that's currently enacted in the city of Las Vegas?
So I think that we are not providing what we need, what the homeless needs when it comes to housing. I do a camp. Am one of the leaders for a homeless camp health fair in the courtyard, and more exactly, we do that at the care center. And this coming Saturday is our next upcoming health fair. So I get to talk to people directly that are in that situation. And one of the reasons for that health fair was to learn from the source why are those people in that situation. And what I learned is that you have 50 people that you're talking to, there's 50 reasons. And some of those people just need a helping hand. They just need somebody to help them find a job, get an ID. Others may need some help when it comes to substance abuse. And yes, there are people that need more permanent solutions. So I don't believe that what we have created in that courtyard is humane. I mean, it's people sleeping on the floor. And I'm from a different country. I have been in the worst at the worst time of my life, I was homeless as well. And sleeping in the train stations is not something that I planned for, nor someplace that I wanted to be in. So bringing back to your initial question, what would I do about homelessness? Prevention would be a big focus. Putting measures in place to see when somebody is about to go in that direction and homelessness is a threat. And that will take a comprehensive approach. That will take the entire community to pay attention. And not only to pay attention and observe it, but do something about it. So putting prevention programs into place would be very important in that phase. Also, exit strategies would be very important to me, and do that in a rapid and very timely manner, so people don't get, if they fall through the cracks, they don't get to become chronic homelessness. And I believe we call chronic homelessness somebody that's been without a home for more than 12 months. So being able to triage the people that are homeless already and assign the implementation procedures to address their needs, it will be very important to me.
So, from your perspective, what do you think the city of Las Vegas is doing right now?
Well, there's a lot of things that we do right. I mean, we are revitalizing the downtown. I think there's a lot of um, movement and a lot of resources for small business owners. Those are things that have been embraced in our city. We are a global town, so being able to embrace some of the challenges and not only embrace it, but actually turn it into our advantage and benefit has been a factor that I've seen in some of the activities of the city. But I'm also going to say that sometimes, from my observation, we get to talk a lot about issues. We say, and honestly, listening to my opponents more closely than ever recently, I hear a lot about recognition of the issues that we have. I hear a lot about we need to do more about this and not just talk about it. And I agree. But what I don't hear the how. I don't hear of how do we address this issue, right? So the fact that I'm saying EMS is in crisis, I don't stop there. I say, what are we doing about EMS being in crisis? What are we doing before it becomes too late? Who are the right people to engage in that conversation? And how do we do it in a way where everybody's word is valuable? Because it is true. It's not about one entity or another. It's not about private versus government. It's about working together. So if I am to look back at some of the things that I have done as a leader in the community, not by myself, but with the community, I can tell you a few other examples that totally entails the entire community working on that. Are you familiar with Nellis Air Force Base receiving non-military EMS patients?
No,
911
I was
patients?
not.
So during COVID, I was in charge of AMR Medic West, and part of the challenge that we had and continues to be today is in the northeast side of our valley, you really don't have a lot of access to care. If you look at the acute care facilities or even freestanding ERs. So quite often we would bypass a perfectly capable facility, which is the military hospital. So the military hospital was approached, and and when I asked if possible to consider to take 911 patients that are not military, to my surprise, the answer was yes. So it took an act of Congress, literally, for them to get trauma accreditation. They had to change the way the access to base happen, their processes, in order to allow for a ground ambulance that does not have the opportunity to do background checks on the EMS providers nor on the patient. So the patient could very well be someone that in normal circumstances would not be given access to the base.
Right.
So they had to
This sounds
change the.
very interesting, but I want to make sure that we wrap up in a timely manner here. I know that you're busy, and I want to wrap up with a fun question. So
Yeah.
as mayor, you can pretty much summon anyone you want to for a long lunch, right? So who is the first person that you would ring up and have a long talk to about the pulse of the city? No Goodmans, so no former Goodman mayors, and no city casters. You can't ask me.
That's a tough choice because there's a lot of great community leaders in this community, and I would love to have a conversation with many of them. I would say that it would depend on what the conversation would be. If I am to talk about challenging the status quo, and reinventing what we do in the city, I would definitely call on our sheriff. And that's because he gets to see a lot of things. And I know I've followed him closely through his campaigning, and bringing humanity back to the table is definitely a big part of what he does. So talking to him about how to reinvent the city and where would be best to start, I think that would be a fun conversation.
Donna Miller, thank you so much for joining us today.
Well, thank you for the invitation, and thank you for the inclusion.
That's all for today here on CityCast Las Vegas. We'll be back tomorrow morning with our Mayoral Mondays wrap-up. As a team, we're going to analyze all of these interviews and give you some behind-the-scenes intel as well. And if you enjoyed our show, why not tell a friend, rate the show, leave us a review, and subscribe to our morning newsletter. Take care.